All right, I'm looking at the buccal mucosa. It's pristine, it's pink and moist. One more time. Big ah, uvula rises on phonation. There is no postnasal drip. There's no tonsillar enlargement. Stick your tongue out, please. Tongue is midline, okay? That is one of the cranial
Did you
nerves where
say,
you will see this again.
no postnasal drip?
No postnasal drip.
And no tonsillar enlargement?
No tonsillar enlargement, okay? Teeth are in good repair.
Good
His
dentition.
tongue is-
Dentitions, good dentition.
Good dentition, tongue is midline. Okay. Now, let's make believe, we're not gonna dim the lights, but I'm gonna simulate the eye exam, the fundoscopic, okay? We've already done the external,
Did you
just
say
don't lay
oral
back
cavity,
yet.
non-
What we
malodorous?
do is, we go like this, and we go like this, and we
Oral
make it
cavity,
sharp, and this
non-malodorous.
part goes to our brow, and we come in, it's dark. Do you have a question? I'm sorry, Gina. You sure? Okay, and you come in from the side, and I say, okay, I have a red reflex, and as I have this red reflex, don't kick me again. I'm coming in, and I can see that red reflex is present. I can see the disc, and the disc is round, flat, and sharp. The AV, artery to veins, ratio is 2-to-1. There's no nicking, no banking, and no bad withdrawals, no banking. No tapering, right, I'm trying, and you do the same on the opposite, okay? So you're gonna do bilateral eyes, you're gonna say the same thing, okay? Everybody's good? All right, where were we now, 'cause I forgot.
The eye, nose, the ear,
Nose, ears, throat, okay.
neck.
While I'm at the neck, you notice I'm keeping her in one position, I'm trying to get as much as I can done, well, without making it up and down and, okay. I already palpated the carotid, and so now I'm gonna check for her thyroid. I'm gonna say, can you please swallow for me? Okay, thyroid gland is non-palpable, and, does this hurt when I do that? Is non-tender, okay? So there's no thyroidomegaly, and there's no tenderness to palpation. While I'm at her neck, I'm gonna take advantage of doing a range of motion test. Even though she has no complaints, it's good to know. I'm gonna put your neck and head through a couple of positions. If anything hurts, please let me know. Okay, gently. Full extension, bring your chin to your chest, full flexion, left lateral, full right lateral, and full left lateral. So she has full range of motion without limitation, and there's no pain, okay, at the cervical spine. Okay, as I progress down, I'm now going to do, a cardiac eval, right? And I can tell you, based on just looking at her, I'm observing as I continue that she's got no cyanosis in her nail beds, there's no cyanosis around her lips. I can tell you, because she's actually does not have clothes on, but a hospital gown, there's no swelling in her legs. So for the most part, visually, things look okay, but I still have to do a couple of things. I have to inspect, and I'm inspecting the thorax. And while I inspect the thorax, I'm going to inspect it for both respiratory and cardiac. And I can tell you, based on inspection, that there's no use of ancillary muscles or accessory muscles, and there is no respiratory distress. She's breathing at a rate of 12 breaths per minute. They are non-labored. What else can we say? Chest is symmetrical and equal. Expansion is even. I'm sorry, yeah, AP diameter is 2-to-1. And again, you know what? She's sitting here without any clothes on. Skin is intact, no cyanosis, no edema, no rash.
The shape of the chest.
Shape of the chest, I'd said is symmetrical. I don't know, is there anything else you'd like me to say? I can't think of it.
It's scaphoid.
I know, it's a long, the other thing now, could you please stand up for me for a moment? I'm gonna ask you to please, turn around, so everybody can see, you're doing great, thank you.
hand's not so
Take a
steady.
deep breath for me, excursion, right, and, respiratory excursion is equal, see how my fingers move equally? And you can do it with her laying down, we'll do that when we do the abdominal exam. The other thing I'm going to do is press, just see if there's any tenderness to the thorax post. Is there any pain? Oh, she's in a lot of discomfort, yeah. there are no nodules, there's no tenderness, there's no pain. And I'm gonna check for tactile fremitus, say or and I can tell you that fremitus is equal distribution, and under here too, say okay, I can feel that the vibration is equal, yes.
For the tactile fremitus, I saw a video in that they keep in the hand like this.
Well, you
It's
can
one
keep it,
technique, yeah.
you know what,
This.
you
or
mean more
this.
like this,
Yeah, it's more on the, no, ulnar.
ulnar,
What
like
we-
that?
What I see from the doctors, they also do
Yeah,
this.
I do it this, I was taught, you know what, is it all right if they do it either way? How do you
Either
feel?
way, yes.
Yeah, either way is acceptable, okay.
And you do it for
Question?
the back also?
And Professor,
And
with
in
the
AP diameter, you could do it up here
you
too,
cannot
right?
measure the
No, you can't, but it's just an idea, you can tell, you believe it or not, when you see somebody who has an AP diameter that's off, you're gonna know. It's not gonna be a big mystery, believe me, okay? Okay, so the other thing, doing this is fremitus, and, now what I'm going to do is I'm gonna auscultate her breath sounds. I've palpated, I can actually percuss, and what should I hear over aerated lungs? Timpani, right? Resonance. Deep breath. You okay? Okay. Oh, shoot, you scared the heck out of me. You know, I tell you, I do one of these real, I'm gonna get,
I know, right?
So you do
Right.
it from side to side, just the
yes,
same?
yes, and I'm right here,
Not on the bones, no.
but not on the bone, right? You don't, because you're not gonna get anywhere. The other thing, okay, so
What kind of a sound?
we palpated, I guess we can auscultate, right? I'm gonna use my stethoscope, and I always just listen over the trachea. Trachea is midline,
Yeah.
and and I'm gonna listen, and it's very high pitched and harsh because it's tracheal sounds. And as I go down, I remember that the bronchi bifurcate at around T3, 4 in the back, and so therefore, if I know where T3, 4 in the back is, I know where it is in the front, pretty much. So right around here, I'm listening to what kind of sounds? Bronchial sounds, and they're harsh, and they're lower in pitch. The lower you go down, the lower the pitch. And as I go this way, and that way, and this way, and that way, I'm listening to bronchovesicular sounds. And what does that mean? I'm listening to sounds that are part where the bronchial meets the vesicle, and the vesicle is the lung. Now, in the back, can you please stand up again for me? See how she's minimally moving? That's a good thing. On top here, we have apices, so I'm just gonna take a deep, the back is where you really hear all the vesicular sounds. God bless you. Okay, could you please take a deep breath? Okay, you don't have to keep deep breathing, because you know you're gonna get dizzy and. In for scapula, don't go over the scapula, stay between the bone and here, and here. Oh, I go across, but you know what? It goes like, okay, go ahead. This is, where am I right now?
Shoulder?
In the apices, right? There you go. Apices. And now I come down. I come down and I go across. And I come down.
Cross.
And I go across. And you just do it. I go down. But make sure you're not in the scapula. And I go across. And I come across. I didn't go down, I'm sorry. Go down. There. Down. There. And now as I get to the bases, what am I doing? I expand, right? So, out. Is that wind? Oh my goodness.
I hope it's not her lung.
I hope that everything's not demolished
That's
outside.
ridiculous.
Feels like a tornado. Okay, now you can turn around. Thank you. You've been a very good patient. Now I can say with confidence, I performed the pulmonary exam, and you know what? The lungs are clear for auscultation and percussion. There are no bronchi, no rails, no leads. The only thing I didn't check was tactile, not tactile fremitus, but subcutaneous emphysema. But she doesn't look like she should have it. So usually that's something somebody with COPD would have. She doesn't show that in her history, so we left that out. Left that out, no, let it. Okay, so we are going to do the heart. Please remember that when you're doing the heart, you need to know your landmarks. So, excuse me, we're on the left side right now. So here's your clavicle. I'm sorry, the right side. Yes. Why am I getting all mixed up? Right side? Yes, right. Everything's on, okay. aortic, so you come from the clavicle down 1, 2, sternal border, and I listen, okay? And I'm at the aortic valve. And I'm listening for what? A murmur. I don't hear any, but I'll tell you at the end. Okay, now I do the same thing here. Clavicle, 1, 2, and I'm here. And I'm on now the left side. I'm at the pulmonic valve. Then I go down to the 4th, right around here, and I'm at the tricuspid valve. In between the tricuspid and the pulmonic is Erb's point. Okay. Then last but not least, we split the clavicle in half, and we go down to around the 5th, which is right under around nipple line on a male, and right under the breast. She would have to displace her breast in order for me to get there, but it's the mitral valve. And after I've auscultated, I can say there are no murmurs, no gallops, and no rubs. That's it. There's nothing else to say. Cut for a minute. How we doing? Am I missing anything?
No, I have to go upstairs, McPherson told me.
Are you okay?
Yeah, I'm good.
Oh, okay. But
It's just applying.
is there anything I missed so far?
Oh, S1, S2?
S1, S2, thank you. Put it back on. Come on, everybody. S1, S2, no murmurs, no gallops, no rubs. Do you have any idea how tired I am?
Actually, your hands are shaking.
I'm exhausted.
Yeah.
I'm exhausted. You know, it's
Everybody's
fatiguing.
pretty
I'm not
Yeah.
nervous, I'm
Take a
tired.
I
rest.
have to go upstairs.
Okay. All right, let's take 5. Can we just take 5?
Yeah.
Sit, please sit.
No, but I'm fine. I'm not gonna pass out or anything. And I don't get nervous when I do this, it's just I'm exhausted.
Huh?